Yeah, I'm doing it.
5, 4, 3, 2, 1.
Okay, so we are going to be looking at Nate's situation using Neuman's systems model, which was created by Betty Neuman in 1970. So we have a diagram up on the screen here that you can look at and follow along. It's a semi-complex theory, but we'll do our best to break it up for you. So originally it was created as a teaching aid for nurse educators, but its purpose has evolved over time.
And the purpose of Neumann Systems Model is to provide a framework for nurses to understand the challenges a patient goes through by describing the relationship between the patient and his or her environment. So what parts of the patient and how does the patient interact with their environment?
We're targeting adolescents, primarily an 18-year-old leaving for college. So this can look into college students and young adults, such as Nate, who struggle with chronic conditions such as depression, anxiety, and panic attacks.
And so a brief description of the way that the system is laid out. The basic unit of Neumann Systems model is the client system, which exists at a few different scales. The individual scale, which is one person, the family, the community, and the society client system. And at each of these scales, the client system also comprises 5 interacting variables, which are the physiological, the psychological, the sociocultural, the developmental, and the spiritual. Another way to look at the client system is as being a central core, which is the basic structure of the system, and it's the source of the energy resources that the client system uses. And outside of that central core are a couple levels of lines of defense or protective boundaries, including the normal, which is the day-to-day line of defense, and a flexible one that changes and adapts to different situations. The client system is acted upon by its environment, which includes internal and external stimuli, and those stimuli can include stressors. So if a stressor penetrates one of those lines of defense, then the client system is going to experience a variance from wellness and stability, which are sort of the homeostasis of the system. If the stressor and the variance progress, they can become an illness if they're not corrected, and an illness can cause energy insufficiency where that basic core that's the source of energy isn't sufficient to meet the needs. And if that happens, then our goal is going to be to reconstitute the system, which is to use the available resources to adjust to the stressors or avoid the stressors and regain stability.
All right, and this theory can be used for actual or potential future problems during the nursing process, during the diagnosis stage. The variables are assessed using questions, and then the goals of the interventions are going to be those primary prevention, secondary prevention, and tertiary prevention. The variables that are going to be assessed are 5 interrelated variables of the client system, and they interact with the internal and external environment. The first variable is physiological, and that variable relates to the bodily structure and the internal environment. And some questions that are used to assess that are how you feel physically versus, and how do you usually feel physically?
The second variable is psychological. The psychological variable is a mental process and interactive environment, both internally and externally. This can also refer to the meaning of the person, of his or her personality, and how they express their emotions. So some questions we can ask during a screening are, what do you think about your mind? What do you think about your emotional state? How do you feel emotionally today? How do you usually feel emotionally? And what happened to you that makes you feel this way?
The third one is social cultural questions, and these relate to common beliefs, behaviors, and characteristics to members of a certain group. So questions that the RN case manager can ask to assess Nate's resources are: what recent changes have you experienced in your lifestyle? Who in your social network, such as your family, school, or within your music community, help you manage your anxiety and type 1 diabetes? And what does your society and culture believe about a young adult's role in the family? So, for example, in your culture, do adolescents assume independence, or do they continue to depend on their immediate family members?
The fourth variable is the developmental variable, which looks at age-related developmental processes and activities and assesses them. So with Nate, some questions that we could ask include: what are his current goals for himself? In what way have his personal goals changed lately? And what has happened to result in those changes in his goals lately.
And our final variable is the spiritual, which is the role that beliefs and spirituality play on the system. Questions that we can ask are, what does spirituality mean to you? What are your spiritual beliefs? What role does it play in your life, and what role does hope play in that? Then follow that up with, have these things changed from the norm recently, and what is the cause of those changes? And also in Neuman's systems model, the interventions that we use to protect the client system are the 3 levels of prevention. One of the concepts here is that prevention is intervention. So we'll talk a bit about each of the levels of prevention.
So primary prevention's goal is to reduce the possibility of encountering those stressors in the first place, and then to strengthen that outer flexible line of defense and push it out further so that it takes more stressor to actually create that variance. Some examples of that applying to Nate's situation would be to make sure he has a good understanding of his condition of diabetes and how to use insulin in his care, having some reminders set on his phone to check the sugar, letting his friends know about his diagnosis so that there's other people to remind him if something goes wrong. And then finding a diabetic clinic in Chicago so that when he's there, he has access to some place that can answer his questions and address his concerns.
Some more examples that fall under primary prevention: that Nate should continue his passion for music. So since he loves playing the piano, he can incorporate maybe bringing a keyboard into his dorm, or maybe joining the school band. Nate should also continue to follow good nutrition, exercise, meditation, social and emotional outlets. So this would include his friends, like Jennifer had said, his roommates, and then also letting his RA know his situation. And lastly, he can continue educating and training himself on his chronic conditions.
So secondary prevention interventions for the stressor action plan for Nate to bring when he moves into his college dorm, there are 4. The first one is measuring his blood glucose at scheduled times. Actually, there's only 3. The second one is seeing a provider by the college campus in Chicago to test his A1C levels regularly and to see clinicians to provide care for his mental health. For example, he can go through cognitive behavioral therapy. And then more importantly, the last one is to make sure that Nate is taking the appropriate dosage of his prescribed SSRIs and insulin.
So for tertiary prevention is wellness maintenance achieved by means of existing strengths. which can almost constitutes like a continuation of some of the primary and secondary prevention interventions. But tertiary prevention can be met through, as it says in the diagram there, readaptation and reeducation, and maintenance of stability. So part of our intervention for Nate would be to prepare him for complications and unexpected issues of like his conditions, or just like, you know, anything that could happen in life. So we would basically lay out a plan for him, so that like when he has unexpected stressors and stuff, he might, you know, need to make a last minute appointment to go see a therapist or meet with a counselor or something along those lines. And also prepare a plan for him, so that if he starts having, you know, symptoms of DKA again, then he, you know, knows when he will need to go to the emergency room to take care of that. And then, of course, if something like that happens, then part of his plan will be to provide re-education on, you know, those primary and secondary interventions that he's supposed to be, you know, sticking to as well.
It sounds like a well-rounded stressor action plan.
All right, that's all we have, I think. So thanks for watching.